We begin at 5 o'clock with Portland's homeless crisis. And this is a live look at City Hall, where hundreds of people are showing up today to testify in response to the mayor's 5-part plan to address homelessness. That plan includes a ban on unsanctioned camping across the entire city. Thank you for joining us. I'm Laurel Porter.
And I'm David Mulco. It's a proposal that has raised significant questions and so much interest. This hearing, essentially the next step in this process, could last well into the evening hours. Let's bring in Blair Best outside City Hall. Blair, you've been covering homeless issues and this plan extensively. Now we're hearing from those both in favor and against.
This is arguably the most significant and broad approach to tackling homelessness that we've seen in recent years. Now, I just left council chambers, and I can tell you it is both emotional and tense in there as people share their response to this crisis and this plan. More than 200 people signed up to testify today. Now, earlier today, we were in Old Town, and this plan is quite literally the talk of the streets there as people were rehearsing what they plan to say to council. Now, public testimony started around 3 o'clock today, and people have 2 minutes to speak. We're hearing from those who think it's a step in the right direction and others who say banning homeless camping will further harm the homeless. Now, let's quickly break down the plan. It includes a ban on homeless camping over an 18-month period and building 3 giant homeless campuses instead that would each hold up to 500 people. Now, it calls for 20,000 affordable housing units by 2033, which the mayor is calling a moonshot. He's also proposing changes to city protocols so the homeless can easily access addiction and mental health services, along with making it easier for those cited for low-level offenses to get jobs. Now, it's important to note that the city is waiting on funding from the state and county before they can move forward on any of this. Now, council will vote on this plan November 3rd, but today the community is taking the opportunity to speak out.
And we were thrilled to see significant and actionable ideas about how to address in an urgent manner what we see on the streets every single day, and that is a significant challenge to our business community. So we were thrilled.
I feel like that part of the plan really needs to be informed by people for whom it impacts. And you know, I know from around here, our whole morning, everyone's been talking about it. All kinds of people for whom, you know, it's going to change their lives. And so I think, you know, whenever you're talking about policy that's actually going to change people's lives, then they should be brought into the room.
That was Kaya Sand from Street Roots. That's a nonprofit that advocates for the homeless. They're holding a viewing party of the hearing where homeless people will have the chance to testify virtually. Now, I also want to mention that all 3 gubernatorial candidates support this plan in some form. Now, we're told that because of the high number of people who registered to testify, that this meeting could last until 11 p.m. David, Laurel.
Wow, which speaks volumes about the fact that maybe we can all agree that we need some sort of solution here. Blair Best outside City Hall. Thank you, Blair. Developing this evening, yet another bad break for the owner of the Pepe Chile carts in North Portland. He says one of his workers was robbed at gunpoint while on the job at a cart on North Williams. And as Mike Benner reports, it comes just a week after a fire and break-in at another location just a few blocks away.
Oh, dice que aquí hay que prenderlo, eh?
Wednesday morning at the Pepe Chile food cart on North Williams, Antonio Diaz is back at work just hours after he was robbed by 2 men, one of whom was armed with a gun.
He had it here at the chest. I don't know if it was real, if it was toy, or I don't know, but in that moment you get scared.
Hurry up. Yeah. Don't make a scene.
Although you wouldn't know it by looking at surveillance video of the Tuesday evening holdup, Diaz appeared calm. He says one man ordered him to empty the till, while a second man, the one with a gun, stood watch off to the side. Diaz tells us he gave the men upwards of $600 in cash and an iPhone before they took off running down the dark street.
That's life, no? I mean, everything, every day, everywhere it happens, so it's just us. So, but we need to continue. That's life.
If Diaz comes across as resilient, it's because he and his colleagues are. Just listen to this. In early September, a fire destroyed a second Pepe Chile food cart, this one on North Vancouver.
Well, I'm upset because
Owner Julio Mendoza managed to reopen, but only days later, he He had hundreds, if not thousands, of dollars worth of tools stolen in an overnight break-in.
I get angry and stressed and frustrated. But let's wait for the next one. It's coming. What we can do? Nothing.
And for proof, look no further than the robbery at the Pepe Chile food cart on North Williams.
It's like a rat. They see what it is and they attack.
Both Mendoza and Diaz
I really got scared.
hope police can track down the bad guys, but they're not holding their breath.
They were with the face mask they had, and hardly saw his eyes. So I don't know if they can recognize him. So.
Talk about a business that has been through a lot over the last month or so. Food cart staff is asking anyone who recognizes the suspects in that video to give the Portland Police Bureau a call. Reporting in North Portland, I'm Mike Benner for KGW News.
Portland police are searching for a hit-and-run driver after a deadly collision today. It happened early this morning around 5 at North Interstate Avenue and Russell Street. Officers found a man dead in the road. It appears he was hit by a car, and the driver who did it was gone. Anyone with information should contact Portland Police.
A new poll in Washington shows the top issue for voters in the Evergreen State are abortion and inflation. In Oregon, statewide, they are crime, education, and taxes. Again, this is going to depend on which poll, who is surveyed, and the timing, though we have seen the Democratic candidate for governor, Tina Kotek, highlighting her position on abortion rights as she campaigns across the state. So today, Kotek was at PSU on day 3 of what she is calling her Defending Our Reproductive Rights tour. Now, for context, what we're hearing from political experts is that abortion access would be a very difficult thing to overturn in Oregon, and that is because abortion rights are written into the state constitution, which the governor herself could not change. And that's something we've heard echoed in Republican candidate Christine Drazen's comments. Well, she maintains, of course, she is anti-abortion. With Democratic majorities forecast in the legislature, political watchers say it is unlikely we'd see any major changes to abortion access, even if Drazen were to become governor.
Outright ban would probably completely be off the table. I think you'd have to have a basically full control of the governor's office and the legislature.
All right, you can hear where all three candidates stand on the big issues. Just check out our KGW Oregonian debate in the race for governor. It's available right now on our KGW YouTube channel, or just search KGW Full Debate.
A respiratory virus called RSV is surging across the country. Hospitals in many states are reporting they're at capacity, with children coming in really sick with RSV. But in Oregon, doctors say we're in pretty good shape for now. Bryant Clerkley joins us now. And Bryant, you talked with a doctor. You got the latest numbers of where we're at with this virus.
Yes, Laurel. So far in October, only 2.5% of the tests are being done for RSV are coming back positive. That's good, but a Providence doctor says he's seeing an uptick in cases, and the season is starting earlier this year. They started popping up in August, and it's why this year could be much worse than the last 2 years.
The headlines have been everywhere this week. RSV cases surging, overwhelming hospitals. RSV stands for respiratory syncytial virus.
And we've seen an uptick in admissions to the hospital.
Dr. Patrick Liu is with Providence St. Vincent. He says we can expect a very robust cold and flu season this year. The Oregon Health Authority says the positivity rate on RSV is under 3% right now. But Dr. Liu says this could change as we get further into the winter.
The increasing amount of hospitalizations we've seen here at St. Vincent's over the past couple of days, I think that rate is going to continue to increase and possibly get to higher levels similar to what we've seen in the past, or maybe even more.
It's all because we're not wearing masks anymore or social distancing. We're back in the world again after so much time isolated at home and not being exposed to everyday germs. But RSV particularly can be very bad for kids.
Since they haven't been previously infected, they're reacting to it as if it's the very first time their body's ever seen it. And for some of these children who are born in the pandemic, this really is the first time they've seen it.
The symptoms are a runny and stuffy nose, cough, fever, sneezing, wheezing, and a decrease in appetite. It spreads through close contact.
And in young infants who can only breathe through their nose, they get into a lot of trouble because of that stuffiness. And so they're using all this energy to try to breathe through their nose.
There is no vaccine for RSV, and according to Dr. Liu, the flu shot doesn't help against it, but he still recommends it for children over the age of 6 months.
Washing your hands really well, covering your sneeze, covering your cough, using a tissue. These are all good things to be teaching your children.
RSV can also be bad for older adults who can end up hospitalized, according to the CDC. And there are nose swabs at your urgent care or doctor's office that can test for flu, COVID, and RSV at the same time. David?
Well, let's hope nobody gets all three of those at the same time.